Welcome to Drugs and Dermatology. In this video, we will be discussing the current FDA-approved anti-CD20 agent relevant to dermatology, Rituximab, also known as Rituxan. This is one of the most historically important monoclonal antibodies ever developed. Originally approved for oncologic indications in 1997, it received FDA approval for pemphigus vulgaris in 2018. An important note is although this class of drugs may be utilized for a wide range of treatments, we will be looking through a dermatology lens focusing on dermatological diseases that are FDA approved. So, let's break it down, drugs in dermatology style. Rituximab, with the brand name Rituxan, originally developed by IDEC Pharmaceuticals, is a chimeric IgG1 monoclonal antibody targeting CD20, a transmembrane phosphoprotein expressed on the surface of pre-B and mature B lymphocytes. It is administered exclusively by intravenous infusion. In dermatology, Rituximab's primary FDA-approved role is the treatment of moderate to severe pemphigus vulgaris in adults, where it serves as a first-line steroid-sparing biologic therapy. Its approval for pemphigus vulgaris was based on the Ritux-3 trial, which demonstrated superior complete remission rates with Rituximab plus short-course prednisone compared to prednisone alone. Although we won't focus on non-FDA approved treatments, it's important to know that beyond its FDA approved dermatologic indication, Rituximab is used off-label across a broad range of autoimmune skin diseases, including bullous pemphigoid, mucous membrane pemphigoid, cutaneous lupus, dermatomyositis, systemic sclerosis, and cutaneous vasculitis. Rituximab was originally developed by IDEC Pharmaceuticals beginning in 1986. It received its first FDA approval in November 1997 for relapsed or refractory CD20 positive B-cell non-Hodgkin lymphoma, making it the first monoclonal antibody approved for cancer treatment in the United States. Eventual approvals followed for additional non-Hodgkin's lymphoma subtypes, chronic lymphocytic leukemia, rheumatoid arthritis, and in April 2011 for granulomatosis with polyangiitis and microscopic polyangiitis. The key dermatologic milestone came in 2018 when the FDA approved Rituximab for moderate to severe pemphigus vulgaris in adults based on the Ritux-3 trial. Rituximab holds one FDA-approved dermatologic indication, moderate to severe pemphigus vulgaris in adults. Its remaining FDA-approved indications are outside our primary scope of dermatology. CD20 is a transmembrane phosphoprotein expressed on the surface of pre-B and mature B lymphocytes. It is not expressed on hematopoietic stem cells, pro-B stem cells, or terminally differentiated plasma cells. This means Rituximab depletes the mature B compartment while sparing stem cell-mediated B-cell replenishment in the long-lived plasma cells that produce existing antibodies. Upon binding to CD20, Rituximab mediates B-cell lysis through three mechanisms. First, complement-dependent cytotoxicity. Second, antibody-dependent cellular cytotoxicity. And third, direct induction of apoptosis. Regarding the specific context of pemphigus vulgaris, B-cell depletion reduces the production of autoantibodies against desmoglein 1 and desmoglein 3, the adhesion proteins whose disruption by these IgG autoantibodies causes the loss of keratinocyte cohesion and the formation of intraepidermal blisters characteristic of pemphigus vulgaris. Rituximab carries an FDA boxed warning for four serious concerns: fatal infusion-related reactions, occurring within 24 hours with approximately 80% of fatal reactions at the first infusion; severe mucocutaneous reactions, including Stevens-Johnson syndrome and toxic epidermal necrolysis; HBV reactivation causing fulminant hepatitis, which is why we require mandatory pre-treatment screening, and progressive multifocal leukoencephalopathy due to JC virus reactivation. Beyond these boxed warnings, the most clinically relevant adverse effects are infections, hypogammaglobulinemia, and cytopenias. Cardiovascular events, interstitial lung disease, renal toxicity, and tumor lysis syndrome have also been reported. Known hypersensitivity to rituximab is a major contraindication. Active serious infections require withholding rituximab and instituting appropriate anti-infective therapy. Severe heart failure or severe uncontrolled cardiac disease is considered a contraindication given the risk of fatal cardiac events during infusion. Pre-treatment HBV screening is mandatory given the reactivation risk. Live vaccines are not recommended during treatment. Rituximab can cause fetal harm, and females of reproductive potential should use effective contraception during treatment and for 12 months after the last dose. As always, we will close our video with a table going over the main talking points. I hope you have a better understanding of the anti-CD20 therapy, Rituximab. This is meant for educational and informational purposes only and cannot be used as a substitute for medical advice, diagnosis, or treatment. Thank you for watching, and see you in the next video.